குளோபல் கேன்சர் கன்சர்ன் இந்தியா அப்படிங்கிறது ஒரு தன்னார்வ தொண்டு நிறுவனம். இது 1998 டெல்லியில் ஸ்டார்ட் பண்ணி இப்போது இந்தியா முழுவதும் 17 இடங்களில் அதனுடைய பிரான்ச் ஆஃபீஸஸ் இருக்குது. எல்லா இடத்துலையும் இந்த கேன்சருக்கான ஸ்க்ரீனிங் கேம்ப், ஸ்காலர்ஷிப் ப்ரோக்ராம், அது இல்லாமல் இந்த பாலியேட்டிவ் கேர் அப்படிங்கிற ஒரு ப்ரோக்ராமெல்லாம் நடத்திக்கிட்டு இருக்காங்க. இந்த வருஷம் இப்போது நாளை காலையில் நமது மாண்புமிகு அமைச்சர் கே பாண்டியராஜன் அவர்கள் அதை ஃப்ளாக் ஆஃப் பண்ணுறாங்க அந்த ப்ரோக்ராமை அவருடைய ரெசிடென்ஸில். அதை பற்றி ஒரு ப்ரீஃப் நோட் உங்கள்கிட்ட சொல்கிறதுக்காக டாக்டர் பக்ஷி ஃப்ரம் டெல்லியில் இந்த நிறுவனத்தினுடைய தலைமை செயல் அதிகாரியாக இருக்கார். அவர் உங்கள்கிட்ட இங்கிலீஷில் பேசுவார். பிறகு உங்களுக்கு என்ன தமிழ் டிரான்ஸ்லேஷன் வேணுமோ அதை கேட்டிங்கன்னா then நான் உங்கள்கிட்ட ஷேர் பண்ணிக்கிறேன். Now I request Dr. Bakshi to just brief about our activity.
India is working nationwide for the cause and care of people afflicted with cancer, and our focus is on the disadvantaged people. We are having operations in 20 locations in the country, and we have been doing this work for the last 20 years. In Tamil Nadu, in Chennai, we are embarking upon a project which is mobile palliative home care service for the people who are victims of cancer. You will see that in India there is a huge cancer burden because the facilities of diagnosis and treatment, screening are lacking miserably. Although the government is doing its best, but still there is a glaring need that the NGOs should come forth to supplement the efforts of the government in providing care to the people who are suffering from cancer. Cancer also needs mainstreaming in healthcare, public healthcare system, because there are other diseases which are being given preference, but cancer is very dreadful disease. It involves lot of money for the treatment. Even then, it is not having the place in the scheme of things. So there is a need that the government should provide maximum attention to this disease. The NGOs are working to support government, and since Global Cancer Concern India is working nationwide, we have been able to considerably support the government, and it has been acknowledged by the government also. So in other places we are having variety of programs like mobile service for the cancer patients. We are doing a lot of work in prevention. Prevention is having two-pronged approach. One is cancer awareness, because people are not aware about the cancer. So we are trying to make the people aware through our various programs which are organized nationwide in the schools. We sensitize the student community regarding the risk of smoking because it causes lung cancer. Also, we organize programs in RWAs, in senior citizen associations, in Rotary clubs, in Lions Club, in Ladies Club, so many social clubs we are approaching, and we sensitize the people regarding this disease. We are also supporting the children which come from the families which are having cancer in the family, like the parents are having cancer. our children themselves are having cancer. So to these children we provide support in a program, GCCI's program, which is called Student Sponsorship Program. We provide them assistance till they pass out from the school, which is about 1,500 in 3 months. So every month they are getting 500 rupees. Suppose there are 2 children in the family, they get 1,000 rupees. So as I told you that our focus is on the poor families. So whatever work we are doing, wide spectrum of programs what we are doing, they are being done in rural areas or urban slums. And as you know that a lot of expenditure is required in the treatment of cancer. So whatever is possible, being an NGO for us to provide in form of monetary support, we are doing. We provide the people, the families who are found with cancer, immediate relief of rupees 10,000. Immediate relief on the basis of the documentation we provide them. And also the people who are relatives of cancer patients, we provide them training in various things like sewing and tailoring, computer, so that they can earn their livelihood, and the economic burden on the poor families is mitigated or reduced. So these activities are being done across the country, and in Tamil Nadu we have a plan that we will be expanding our operations. We have started this in Chennai. This incidentally, I would like to tell you that the cancer burden in the country, which is very huge, 10 lakh people, 1 million, 10 million people, 1 million people, 10 lakh people, these 10 new cases are added to the cancer burden. About 5 lakh people die of cancer every year. So these figures are going to be doubled as per WHO projections within 20 years. So keeping in view a large population which is having cancer or which are going to have cancer, there is a need that more and more work should be done in this direction. So we are doing this work as per to our level best, and we are now expanding. In Tamil Nadu, the cancer burden is 55,000 new cancer cases are added to cancer burden in the state of Tamil Nadu. So in view of that, and in view of the facilities available and the need for the facilities, we have launched this program, which is mobile palliative care home care service for the cancer patients, and which will be going to poor localities in Chennai, and will also be touching neighboring localities, rural areas, and we will be providing regularly this home care service, which includes dressing, which includes pain relieving medicines, which requires counseling to the families, which requires training the caregivers. So all these facilities will be provided by this unit, and we are going to expand this thing to other parts of Tamil Nadu, and so that this burden, the cancer burden, which is in state of Tamil Nadu, that gets reduced. So these are the important things which I wanted to tell you about this program and about the organization. Now if there are questions, you are most welcome to ask.